Patients come to me and say, hey, it's not about like the bite, the first question is about how it's going to be, how it's going to look.
And we live in a selfie world.
Wow.
Do you think of an example that knowing what you know today, you would have done differently there?
I am a surgeon, as I said, and all the time I was like, oh, the sutures and the grafts and the minimal invasive approach, buying blades, like being the best of surgeries. That was my goal. And then I just realized that after many years, that prosthetic design is
Gustavo Giordani, what a joy to have you with us at Straumann ProTalk Clinical.
It's a pleasure. Actually, it's an honor with you. It's a pleasure, really.
Thank you very much. I would like to start with the fundamentals. When we talk about immediate implant in aesthetic region with soft tissue management, there are a lot of steps in between. But if we have an opportunity to define, how would you define what is a successful outcome when we approach this technique?
Oh. When I started implantology, it came from my father, and of course, functional result was the goal. Okay, replace the bridge to an implant, and then when I start to understand the importance of the combination of functional and aesthetic result, everything changed for me. And I came from the maxillofacial field, so we're not very used with soft tissue grafts. So when I went to Belgium to be trained by Derek Mandorin, everything changed, and I started to understand how important it is to work with soft tissue, how important it is to graft around the implants, and if I can just target the perfect result for implants today, it's really this combination of functional result, functional, let's say biological result, and a beautiful look that nobody can see that is an implant, and soft tissue is very important for that.
You know, if we could quantify, let's assume, what are the biological parameters? Is it volume? Is it contour? Is it papilla?
Yeah.
How do you say, all right, this is a good outcome?
I think when you think about aesthetics, it's pretty much a lot of things together. It's a combination. When you think about like a natural tooth, you will see a nice emergence profile, not a fake one. You see that the tissue is really touching the tooth in a very nice position. The papillas are perfectly in position. I mean, the combination of this pink and white aesthetic, I think it's really the key. When I have patients come into my office, say, okay, I need to extract your central. Doesn't matter why, like a fracture or something. The patients come to me and say, hey, it's not about like the bite, the first question is about how it's going to be, how it's going to look. So if I say like the nice result and aesthetics is really that perfect emergence profile, the volume, the color of the tissue, the papillas, and of course, without scars, without any interference of color or like a fibrous tissue. So it's pretty much a natural look of tissue and emergence profile of the teeth.
You know, I like what you say, because if we look at every single mobile phone company today, every launch they go through, it's very minimally related to the functionality, how well you can talk to your loved ones.
Yes.
It's about how good your camera is today.
Perfect.
And we live in a selfie world, and the patient experience matter, how they look in the end matters, and it's all reflected in also how we should also approach our cases. And this is a perfect opportunity, because we often hear clinicians say, well, I graft in, bone substitute, I'm done. But it's not quite like that, right? Why do you think today we may have this gap in between the understanding, or do you think it's underrated or underestimated the need graft in, graft out type of approach?
Yes, I think it's because of the huge past we have with biomaterials and like growing bone and bone and bone to place implant. And this, if you go to universities and all the teaching process, you're going to see like a lot of big surgeries, a lot of bone around the implants, big approaches of bone reconstruction.
Right.
And now today, not today, but like From many years ago, we started to look at the tissue and understand how important it is to have a good amount or good volume of connective tissue graft, which is not physiological. I mean, it's not that you're going to extract a tooth and a patient will come with 3 millimeters of soft tissue. You really need to add something. It's very important to do that. And we understood that. And I think this, I'm not going to use the term revolution, no, but this, let's say, path, this direction came because the aesthetic look is pretty important as the functional result. So I don't want to just create a nice functional result for my patient and see a concavity and start to see after extraction and maybe few months or years later, like gray color of the tissue, a small recession. And we know today to really create that stability and this aesthetic look, I need soft tissue, not like 10 millimeters of bone around the implant, but just bone enough and nice connective tissue graft around the implants to create that stability and the aesthetic look. And I think everything is changing with the papers and everything, with the, of course, patients coming to you saying, hey, I did this 2, 10, 15 years ago, and it's not okay. What happened? And now you see that the majority of the problems, it's a concavity, it's the color and means lack of connective tissue, lack of tissue.
Well, the techniques also have changed drastically, right? In the past, when immediate implants in aesthetic zone started, it was idealized. The implant should be a cork. You should plug that socket. Later down the road, we find out that the narrower the better, not the wider the better. It's not about that, right? So it's not. We have to be also. How would I say? To be respectful with how things evolve. That we don't always know. We think we know, but we don't know what's next.
Yes, and I am pretty sure that after 10 years, if we start this conversation like 10 years more, we are going to change a lot of things that we are talking now. And this is the reality. This is evolution. So I think we need to be very thankful of like all the mistakes we did in the past because we learned from them. And we are still learning. I mean, when you think about like grafting, connective tissue graft, I remember 10 years ago or maybe more, when I started to do this, I started to graft a lot. And then now I see my results and I see that maybe the result it's too much or it's too aggressive or the tissue is growing. So you always adapt your technique and of course you learn from the mistakes you did, but it's a learning curve. I mean, I remember seeing like so many nice lectures from Boozer, from Khan, from many amazing speakers, like doing amazing things that we today say, no, this is not the way to go. But I mean, we learn from them. And then now we know how to avoid the mistakes and more and more and more and more. And in the future, maybe more and more. I don't know.
I always highlight this one conversation Joseph Kahn, he always brings to his lectures that he published a nice article saying, well, this is what I did with the immediate solution. Look how nice it looks. This is what you should do. Then the patient calls him back. 10 years after, Dr. Kahn, I need to see you urgently. And when he heard that word urgently, the back hair stood up and it said urgently is normally a problem. And that was this big recession. And then he was treated again with smaller diameter implant, graft in, graft out, a nice alternative. And then he was kind enough to publish another article saying, look, what I wrote back then, please forget that. Things are different.
And this is amazing. And this is amazing. And you know, I'm a big fan of my mentor, Eric Van Doren. And Eric today is lecturing a lot of problems that he's like checking with his patients after 15, 20, 25, 30 years. And I remember many cases that he's retreating now. I was there living in Belgium saying, wow, amazing approach. And now 15 years later, okay, maybe I should change something. And this is amazing. And the opportunity to learn from these masters and how they behave today. Okay, I made a mistake. What I have to do to, let's say, avoid or try to control or minimize the effects of the mistakes. I think this is really the key point of a mentor. And for me, it's learning from them.
Yeah.
And I'm trying now and seeing my patients after 7, 8, 10, 12 years, I said, okay, I'm starting to retreat a little bit now, and this is life, man. It's like it's moving all the time, and we are learning all the time.
And with what you know now, since we're talking about learning curve, with what you know now, what would be today pitfalls that clinicians starting in this area, immediate implant with immediate restoration, and then grafting, not grafting, but managing soft tissue in that regard? What are the pitfalls they should watch out for?
I always talk with in my presentations or courses about 4 very important topics. The first one, it's always a minimal invasive approach. We always avoid like huge surgeries. So we don't, when we face a case in aesthetic zone that you need to extract a tooth and place an implant, we always avoid big approaches. So we never lose tissue in order to graft a lot after. So we try to, let's say, compensate or with socket preservation or with an immediate implant and grafting, but try to be gentle with the tissue in a minimal invasive approach. The second thing, do not negotiate the 3D ideal position of your implant.
Right.
And of course, relate this position with your system. Okay, what you are using, what the technology can offer to you, but do not negotiate this, because a wrong position of your implant, it will lead you to a very bad complication at the end. Okay,
And it's of a great percentage of the failures related to 3D.
100%. That's why today I highly recommend do everything guided. Do everything guided. That doesn't make any sense today, almost 2026, to not do this like a virtual plan and a guided surgery. Today we have so many nice kits in the market, a new kit from Straumann. This is really fantastic and help you a lot to avoid this kind of big mistake.
I love what you say there, because it doesn't make you less of a surgeon. If
No,
you do
zero.
There's no ego in
Zero.
that. It just makes
Zero.
you a better one.
Yes, and I had difficulties to understand that.
Yeah.
I was living with Eric, one of the best surgeons I know, and he started to do guided surgery, and I said, why he's doing this? He's so good manually. And then I understood. And today, I will say 100% of my cases, 100, they are guided always, and guided by the prosthetic final result, which is the topic number 3. I mean, always be guided or use your healing process with a perfect provisional, perfect design, and relate that implant with that design. So prosthetic support, it's really the key to have a nice healing and to drive, of course, all your process. So virtual plan according with the final restoration. And the final topic, it will be the tissue management. I mean, it's important, we know from the literature, to work with biomaterials and connective tissue graft. Why? If we are talking here in aesthetic zone, after extraction, you always lose tissue, okay? This is physiological. And in the aesthetic zone, usually you are facing a thin environment, a thin soft tissue, thin bone, which is normal for the area. Of course, change for patient to patient, but it's usually your situation. I mean, you don't extract a central like, okay, the color is not good, I extract. No, usually you have trauma, you did apsectomy, you had some peri-infection. So usually it's like a delicate situation. So it's thin, it's delicate, and after extraction is going to be more delicate. So in order to compensate this in a long term, soft tissue is so important. So it's pretty much the combination of minimal invasive approach, 3D position, virtual plan, guided surgery, prosthetic design, and soft tissue. I think this is really the key to avoid problems in this path.
I love how you contextualize these 4 pillars. Of course, there are learning curves for each of those.
Yes.
But I like this very much. And it takes me, it's a perfect segue to your next question I would like to drive. All right. I'm walking in here. I stumble. I bang my front tooth. I'm looking for Gustavo.
Okay.
I need your help. How would you walk me through your workflow today?
Okay. First thing, it's always put all the data together. So the main point today, it's the virtual plan for me. With Smile Cloud, with co-diagnostics, with all the virtual plan, for me, it's really the most important thing. So if you arrive to me, the first thing I'm going to do is scan your mouth. Even if you are like with a mobile tool, maybe I will splint, okay? I will scan you, I take a tomography, I take pictures, and I put everything in Smile Cloud. Today, I put everything in 3DNA, and I check exactly what I have there to understand if it's going to be an immediate implant case, if I need a reconstruction, which is going to be my reconstruction. So I see you in a 3D environment. And I remember many years ago, this was difficult. I mean, you need specialized people to put everything together, big labs. Today, when you add everything, artificial intelligence help you to put everything together and to match all the files. You start to see the patient 3D and you avoid a lot of mistakes of the decision process. So I will digitalize you fast, put everything in Smile Cloud, analyze, and talk with you. Talk with you like, Christian, you have an indication for extraction. Let me check if you are ready for the implant.
If I'm a candidate.
Exactly. Because sometimes you have like an open bite, you have like a deviation of your midline, you have something to maybe do before the implant, and I need to have this discussion with you now. Because if I am okay, bone and tissue, nice, implant, and then you want to, or you need to do orthognathic surgery, ortho treatment, I don't know, I will lock the position. So I need to have this conversation with you.
Right.
So I digitalize you, I understand your case, and then I move on to the direction it's necessary. So this is really my protocol. When you say yes, and I think that is a case for implant, then we go to the process of guided surgery, placing the implant in the correct 3D position, select my system, select my prosthetic component, design my nice provisional to support everything, plan my graft, everything virtually. And I mean, when I go to the surgery, I have everything prepared to treat you in a very predictable way. That is really the direction.
I like this very much. And then surgically speaking, is there any preferred way you like to approach, diameter-wise, length-wise? How is Giordani selection process,
Okay,
decision-making process?
Perfect. The first thing is first design the tooth. I mean, I need to understand first if it's going to be a oral rehabilitation, if I'm going to change anything, or if it's going to just copy the actual situation. When I design everything perfectly, I go to the software and understand the bone quantity and quality to understand the system I'm going to use. Let's say if I go to BLX or if I go to BLC, I prefer BLC because I like a lot the design. I'm a little bit more used with that design, but I'm learning the yours one. And so I try to select not a wider or a narrow implant. I always try to respect the measurements. So in the virtual plan, I will check like the gap I need between 2 to 3 millimeters. Understanding the spaces is necessary, like from implant to the adjacent tooth, let's say the nerves and everything around. So I select the implant diameter. I like to work with an implant a little bit deeper, like 4 millimeters away from the future gingival margin. I select my prosthetic component, and then, or I print my provisional to just reline everything during the surgery, which is my preference, let's say, till now. And now, from now on, I'm starting to move chairside. With my design, started to do this workflow of extraction, immediate implant placement, scan. After scanning, I go there, design the provisional, print the provisional, 10 minutes. Then I have a dentist working with me, like relining everything, polishing everything very well, fast. Then soft tissue reconstruction, bone reconstruction with biomaterial, and finish with a very nice printed provisional. And if you ask me, this is the most amazing feeling I have in my clinic. It's to do this kind of treatment.
We're going to get there. We're going to get to this question very soon. You mentioned some of your mentors. right? And Van Dorian and so many others that came and helped you shape. And I have this session that is called "It's Not What I Think, It's What I Know."
Perfect.
And it's not based on assumptions, things that maybe work in my hands, but things that are evidence-based. And I would like you to reflect, and if you could share with your audience, if there was an article, a book, a case, or a mentor
Perfect.
that at some point that was a turning point. It made you look from east to west in the way you approach your cases. What was that aha moment?
Wow. Tough question. But I'm not going to give to you here like one article because it's not about that for me. I will say mentors that changed everything for me. As I said, I came from a maxillofacial field with my mentor, Marcos Pita. And then I start in Brazil studying with Implantology. Jolie, Paulo, and Robert, they are amazing. And they, let's say, brought this to Brazil, how to work with soft tissue in a minimal invasive way with implants. So they changed it a lot for
Amazing
me. And
group.
their book, it was fantastic. I think was the first and the second one, I don't remember, but the gray one was amazing. And I read like everything, and this changed it a lot for me. I would say for sure Eric and his articles and the opportunity he gave to me to stay with him in Belgium to really learn from the phone. So he's the persona for me. And I will also add the Iñaki Gamborena book and also lectures, because like Iñaki really showed us how to really work with tissue and the importance of the tissue around the implant. So I will put the three groups here that opened my mind and made everything for me easier with all the tips and tricks and experience, let's say.
Isn't it amazing? I love the fact that we all get inspired by someone or somewhat.
Yeah. I think they give us shortcuts.
Yes.
If I just say, okay, I will do by myself, I think I am the one, I'm going to take like years and years and years and a lot of mistakes. When I see these kind of people that really use their time to teach someone, I mean, Eric just opened his clinic for me, for Victor. We stay with him like here, there,
Amazing.
like spending the time doing shortcuts for us. I mean, hey, don't go to this way. I already did that. And it's wrong, or it's not the best one. Come here.
If
There's
you're
a
wise
shortcut.
enough, you listen.
Mentors for me is they are really the way for me to achieve a nice, short, and predictable learning curve in dentistry. Mentors for me are really the way.
And speaking of experience, you said the mentors, shortcuts, but you know things today that you didn't know back then.
Yes.
Now, and you probably, as you said, you were going through some of the cases that you did a few years back.
Yes.
An outcome could be, with your today's standard, a bit questionable.
Wow.
Do you think of an example that, knowing what you know today, you would have done differently there? Can you share something with us?
Yes, 100%, man. It's really learning the prosthetic phase.
We always remember that one.
I remember, not that one, like the majority of the cases. And listen, I am a surgeon, as I said, and all the time I was like, oh, the sutures and the grafts and the minimal invasive approach, buying blades, like being the best of surgeries. That was my goal. And then I just realized that after many years, because of Eric, because of Florin Kofar, that prosthetic design is really the key to have a very nice healing and, of course, a longevity of your case. It's one of the big keys. And as a surgeon, I was like, the prosthetic part is not for me. Okay, provisional, you do or whatever.
Everybody
I put
else's
something,
problem.
doesn't matter. And I saw so many mistakes I did. And all the time I checked the mistake and said, maybe next time I do one more suture. And then was the prosthetic design. So if I can talk with me, with Gustavo from 10 years, I will say, hey, study, focus, and understand the prosthetic support to drive your healing, to drive your tissue. That is something that I learned now.
And speaking of passion, because as dentists, given your example, you chose perio as a path to go.
Yeah.
But not only that, you master soft tissue management in a context of a rehabilitation, right? So there are always indications that we sometimes, because in the end we're always kids, right?
Yeah.
It's the size of the toy that changes
Yes.
and how expensive they get. But we're all kids in the end. And there's this one indication that sometimes when the patient comes in and there's a diagnosis, you go to the office today with a smile from year 2 years. I'm gonna do that one that I like a lot. Yes. Which one is it?
Man, if I stay in my office, and I talk this a lot with Victor, if I stay in my office doing implants in aesthetic zone every single day, I will be the happiest person ever. Like, of course, I don't want to say to the patient that I need to extract your central, but when I need to say this, I said, nice. This is the best moment for me. I know it's very challenging, but I like a lot. And if I can talk and stay in single centrals, I will be very happy every single day. Yes.
I love this.
Yes.
Gustavo, this was a masterclass. We're all big fans of your work.
Thank you.
And thank you very much once again. If to everybody who's watching us who would like to learn more, because I know in your practice, I've been there in São Paulo, you have a training institute.
Yeah.
If they would like to learn more about immediate implants in aesthetic zone with soft tissue grafting, how they can find you.
Thank you. I have a training center in São Paulo, Brazil. It calls like Studio Giordani. If you want to check on Instagram, is Studio Giordani TC, which is training center. And we have also a website. It's studiogiordani.com.br. So it will be a pleasure. Social media, it's Studio Giordani TC, the Instagram. It's a pleasure to have you there. Yes.
Thank you very much.
My pleasure, my friend. Thank you.
And to all of you, if this content, I'm sure it was for me, it was amazing. If this was valuable to you, make sure, as everything online, to be relevant, we have to stay relevant. Give it a like, share with your friends. Sharing is caring. And until the next episode, ciao.